Hello, everyone. This is Chadi Alraies from RSH 2025. I'm really privileged to be with Dr. Vinayak Bapat to talk about the journey and the launch of the Structural Heart program in Riyadh. Very thanks for being with
Absolutely.
us. Yeah.
Again, thank you very much. I came here after 2016 now, so it has been a big change. I traveled a lot in Saudi as well as Middle East to train them in TAVR and advanced TAVR, mainly King Faisal, Military Hospital, Al Hassa, Jeddah, and Riyadh. And today, what I see here in the meeting has been amazing. Immense amount of experience, not just in standard TAVR, but in tricuspid therapy, in mitral therapy, in very complicated. So the physicians have done a great job in serving the people and the need in transcatheter world.
Yeah. So, during your proctorship or when you launch this program, Vini, what are the biggest challenges for you as proctor when you want to establish a program in any region, not just here, it's any region?
So in the early days, of course, traveling to Riyadh from London, I was in London, was easy. There are always some language and cultural barriers, of course, but we physicians tend to speak the same language, so it was very easy.
Right.
The case planning always was very good here because they were very thorough, and I can see how that has reflects now in 2025 with so many complicated cases they are treating. So in fact, training centers in Saudi Arabia was easier than we thought at that time.
As you mentioned or touched on already, the importance of imaging or pre-planning. So, were you part of that program as well when you are putting that program together?
Yeah, so my role was always more than proctoring, it was more of friendship as well. In guiding centers into taking on complicated work. I still support when people reach out to me for advice in terms of CT analysis, echo, and I guide them in terms of case planning and procedure even today. So I have trained more than 90 countries now, and all the centers I'm in touch with, I think it's because of that bond.
Yeah. Dr. Babat, thank you so much for all you have done, definitely, and the literature you have contributed. Today we had a session, and you touched us on valve and valve, and you mentioned that this is you are one of the first people who looked into that topic specifically. So where are we now in terms of managing of these kind of complex patients?
Yeah. So the wall in wall, as you know, has become a very common therapy, but there are some nuances we are learning. Also, the tower designs are changing, and tower designs usually change to treat the native valve. And we expect them to perform as well when we treat valve in valve, which is not necessarily true. And we are learning that. So the applications which I have launched in 2013, they're used all over the world now. And currently, for example, we have included guidance in valve fracture because many people don't know how to do it.
Yeah.
Many people don't know which balloons to use and what are the downsides of it as well. We have also incorporated very good guidance in terms of mitral rings and tricuspid rings so that people don't take it on without proper planning. And of course, now TAVR failure is becoming common. So there's a new app which we launched recently, last year now. This is on Redo tab. How do you plan the procedure with the CT scan and then take that analysis 3 weeks later in your lab and do the procedure seamlessly? There has been some gap because people always do CT analysis few days before. And by the time you reach the lab, it's a complicated analysis and then you forget anything. So we have incorporated very modern features such as a visual summary, which helps the interventionist to extrapolate what they have done few weeks ago into doing the case. So
That's
I
great.
think there's a lot of improvement to be done.
From your experience, and that's the last question, uh, what is next and most important therapy for transcatheter in the structural space?
I think lifetime management is the highlight for next 5 years. We need to understand, should we do one treatment such as SAVR first or TAVR later or TAVR first or SAVR later. I think it's going to be very challenging. It's more so in this region where in Asian countries and Middle East countries, sometimes patients can choose what they want, not necessarily the European
Guidelines.
or guidelines. Yeah.
Yeah.
So I think we need to definitely engage more with this community to understand, are we doing the right things for the patient?
Right.
I think that is the next challenge for all of us.
Absolutely. Well, Vina, thank you so much for your time.
Thank you.
And well, thanks for watching us. This is Chadi Alraies coming to you from Riyadh Structural Heart 2025. Watch these videos on other YouTube channel and the website. Vinny, thanks again.
Thank you very much again. Thank